I have a question for Amanda. So Amanda, the PRP, I know it's used for microneedling because that's what Trish did for me. So can you give me more information about it? Or what else it could be used for? Sorry.
Yeah, I can tell you lots of things about it. So what it is, so we draw it off of your blood, as you recall.
Right.
We spin it down, we have special tubes for this, and then that gets transferred into a tube with fibrin matrix. So fibrin matrix is, if you've ever had a cut and you see that little yellow that comes out, that's fibrin matrix. Okay. And so what the PRP does when we put it into that is it creates like a matrix for the new cells to grow on. So when we're talking about your skin, we're talking about collagen. We want collagen growth. We want plumpy. We want young. But when we're talking about other places, we can regrow any kind of tissue. So we can inject it into the hair cells. So what happens to a lot of people is before you go bald, your hair cells or your hair follicle becomes micronized, meaning it's just small.
Right.
And so it doesn't get a whole hair. And then your hair gets thinner, thinner, thinner. Eventually that follicle just dies off and then you're bald. So before that happens, we can inject stem cells in and it rejuvenates those follicles and macronizes them again, actually makes them normal size. So then you have just normal size hair and your hair is lush and happy again. Now you cannot let it get it past that point or else we can't do anything about that.
Right.
So that's definitely something that we can do, and we just take the PRP and just do little tiny holes all over the scalp. So the other thing we can regrow is cartilage. Okay. And so all joints have a joint capsule, and with that I pull off a certain amount of blood, usually 3 to 4 milliliters, and then inject it into that capsule. And what that does is regrow cartilage. So if you have a torn rotator cuff, this is not going to be super helpful because we really need to, you're going to need surgery for things like that. Right. But if you have just worn out your knees, for instance, or you've just worn out your shoulder from, I don't know, raking, playing baseball, whatever, we can inject those stem cells in. That matrix will allow the cartilage to regrow, and it is amazing.
That is amazing. Like my friend of mine had, her husband had cortisone?
Yes.
So what's the difference between that and, let's say, PRP?
So cortisone injections, so the first time you get one, they are usually amazing.
Right.
You get less and less results with every one of them because what they are is a steroid.
Okay.
So it's an anti-inflammatory.
Okay.
So when you inject that into a joint capsule, you're going to take that inflammation down in a quick hurry right now. So it feels great.
Right.
Because inflammation hurts. So I don't like using steroids. It is not my favorite thing because I do like a more natural approach. And so for us, what we would do is the low-dose naltrexone to take the inflammation down, and then an injection, the stem cell injections to actually rebuild the cartilage that we've lost.
Oh, wow. What do you tell skeptics who have knee issues that kind of are skeptical about this? How can we convince them to do this?
Well, I guess I would say this, like, I don't ever want to convince anybody to do anything.
Right.
I think people should do exactly the right path. I like to give people education and then they make their own choice. But if somebody wanted to do it but they were, worried that maybe it wouldn't work, you really don't have anything to lose. Like if your knee hurts all the time, your only option is to get your knee replaced. So if stem cells does the trick, and it has about an 80% success rate. If it does the trick,
I think that's what I was waiting to hear. The success rate. Okay,
yes.
that makes
So if you do it and it works, that's wonderful. If it doesn't work, you're not going to get worse. You're not going to hurt more. So then you go get your knee replaced. But if you can put that off for some time or not do it at all. And I think stem cells and physical therapy are an excellent combination. So obviously you didn't do physical therapy while you're doing stem cells because we need to kind of rest those joints while we're doing it. But then after or even before, physical therapy is excellent. And I definitely encourage anybody with body pain in general, physical therapy is really just an amazing solution. And a lot of people don't realize that. They just feel like they need to go right to medications, right to surgery. And it's like physical therapists are magical in the things that they can do. I want people to know that there's not only one answer. Like I'm never going to be like, this is the only answer for this. There's combinations of therapies and there's just different things things that people can do that perhaps we don't offer, but that's the right thing. And that's the important thing about practicing, is that we have to look at the patient and what's best for them. It's not about like, how do we make all the money? It's about how do we make you feel amazing? So some other areas that we can do stem cells in, scar therapy. So amazing. I have seen some amazing age spots and scars.
Yes. Okay, now we make it. Okay, sorry. Now we're putting two and two together. That's funny. Okay.
So for you, the microneedling is going to help both with the rosacea, but we're working on that from the inside with the low-dose naltrexone, but then also the scars that you have, the residual scars. So because it's resurfacing your skin with the microneedling and the stem cells, but we can also do that like surgical scars, for sure. We can just, go over them. We can inject into them. There's just so many different things that we can do with it. We can do the O shot and the P shot, or I should say vaginal rejuvenation, and I'm not even sure what the other term would be for the P shot. But vaginal rejuvenation is amazing for women that have incontinence. So after childbirth, super common, and just those tissues become very thin and they just don't support everything as they used to. Then women start having more and more incontinence, which there is no normal amount of pee in your pants. Just none. So get something done about that for sure. And so the stem cells just really rejuvenate that tissues, really any tissues. Wow. Yeah, I know, it's amazing, isn't it? Yeah. Trish can do microneedling with PRP, and also hair restoration, and she can also inject PRP into areas that we would inject filler. So if you have like under eye bags, and you don't want filler there, we can put in PRP as well. And it's a very natural, I know, isn't that amazing?
I had no idea. Yeah, that is amazing. I had no idea, wow.
Yeah, so you're not gonna get, with filler, you get a result right now. You walk out of here looking fresh and rejuvenated. With PRP, we have to regrow that collagen, so it's going to be a series of 3. All PRP, PRFM is a series of 3. So you're not going to walk out of here looking fresh and rejuvenated, because you have to regrow. Your body has to do that. So we'll take the under eyes. You've got that dark, kind of like allergy eyes. You know what I'm talking about? Okay. We inject into there 3 times. It'll start to get fuller, nicer, the way you want it to look. So anywhere we can inject filler, we can inject PRP for the same effect. But it is going to take longer and be a little bit more subtle. So like if you wanted dramatic cheekbones, you're probably going to want filler for that. But if you just want better facial structure, facial symmetry, then PRP is an excellent option for that. We also can use it, and this is another thing that Trish can do, through the throat area and in the décolletage. So very commonly, people get very thin skin across their chest. They get sun damage. They get all kinds of things. And so we can inject little tiny injections again all over the place, and it just restores that collagen and gives it a nice smooth appearance and thickens that tissues.
Nice. Who knew? I know. Like, this is really exciting.
It is so